Hello. Hello. My name is Monica, your attending nurse for today. How may I address you, sir? You can call me John, nurse. That's fine. All right, John. How are you feeling today? Well, I think I'm feeling a little bit better, nurse. Oh, that's good to hear, John. Now, I understand that you asked to speak with me, so please let me know if there are any questions or concerns that I can address for you. Yes, nurse, actually, I had this little concern, you see, because I am feeling a little bit better. I was wondering if I could go home. I see my children are at home alone and I need to look after them, so I'm a little bit concerned about that, nurse. I see. So, what you're saying, John, is that you want to get discharged because you want to look after your children at home. Is that right? Yeah, that's right, nurse. Well, I understand your concern, John, but I'm afraid that your chest infection has not yet resolved completely, which is why I would strictly advise against getting discharged from the hospital. If you get discharged now, the infection can become even worse. However, there's something that we can definitely do about your concern regarding your children. For that matter, can you tell me if there is any person in your family who can look after your children while you recover in the hospital here? Well, if it's that important, nurse, then I guess I could get one of my relatives to look after my children, but just for a day or two, nurse. Would that be okay? Yes, that would be great, John. Now, if you don't have any more questions, I would like to discuss the next steps of your treatment. May I, John? Yeah, sure, nurse. I don't have any questions. Okay, John. So, first of all, to make sure you are recovering as soon as possible, we are going to insert a cannula into your arm. And secondly, we will administer appropriate medication to treat your chest infection with the help of this cannula. And finally, we'll continue monitoring your recovery. Is that clear, John? Um, I think some of the steps are clear to me, nurse, but I don't really know how a cannula is inserted or where is it inserted really, like what the process involves. I'm a bit concerned about that. Hmm. No worries, John. I'll explain the procedure to you. So, the first step to insert a cannula is to use a very small needle to insert in the vein. That vein can be on your arm or on your hand as well. The second step involves using a small tube in place of the needle, and that's how we insert the cannula. Is that clear, John? Yeah, well, that's clear, nurse. It's just that I'm a little bit afraid of needles. I mean, just to even think about them, I kind of want to take my hand away. So I don't really think it's a good idea, for me to go ahead with this cannula thing. I would prefer if you give me antibiotics in tablet form, nurse. Well, I can understand why you're worried about that, John. But it is best if we use the cannula instead of using oral antibiotics because you see, you have a chest infection and it is best treated with IV antibiotics as they get directly into your bloodstream and as a result, they work relatively quickly as compared to oral antibiotics. And as for the needle, John, I assure you that it's going to be a very small needle which only feels like a prick. But just for your convenience, I will also use a topical anesthetic which will numb the area for a while, and you will not feel a thing during cannula insertion. How does that sound, John? Oh, if that can be done, I mean, if the topical cream can be used, I think that would be great, nurse. Because, see, with the needle, it's the pain problem I have. If that can be taken off care of, then I can surely have this cannula inserted without any concern, nurse. Well, I am very glad to hear that, John. Now, do you have any other questions or concerns that I can address for you, John? No, nurse. I don't think I have any more questions left. All right, John. Then I would like to start ahead with the cannula insertion process. Can I do that? Yeah, please go ahead, nurse. Thank you, John.